You're listening to Conferences Online Allergy from Children's Mercy Hospital in Kansas City, Missouri. Today is August 19th, 2024. Our topic is Complementary and Alternative Medicine in Allergy Immunology. This is presented by Dr. Christopher Miller, an assistant professor of pediatrics and is the program director of Allergy Immunology at Children's Mercy Hospital.
Talking about today is complementary and alternative medicine in allergy and immunology. I have no disclosures. And here's our objectives. Number one is to define complementary and alternative medicine. I'm going to call it CAM for ease of pronunciation. Understand why individuals seek out the use of CAM. Review the current data regarding use of CAM and allergic disorders. And then how to counsel your patients on this topic. A couple definitions up front. Complementary and alternative medicine, CAM, is a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. In contrast to that, what we are typically practicing is allopathic medicine, and it's just referring to the science-based modern medicine, such as use of medications and surgeries, in which we have, good data on its outcomes. CAM can also be kind of merged in different other diagnoses, and I'll throw complementary, alternative, and integrated. Complementary medicine is used together with conventional medicine, and here's an example: aromatherapy and analgesics, post-operative pain management, or Tai Chi and anxiolytics for anxiety disorders. So that's pretty simple. Alternative medicine is used in place of conventional medicine. This is an extreme example, but diet modification to treat cancer instead of surgery. And then integrated, it's a little bit of a blend. It's taking conventional, merging it with CAM. There may be some level of evidence of that CAM product to use with the conventional, and an example has been the statins for your lipid-related disorders, and then fish oil. And I recognize that fish oil has been in favor and out of favor, and for those who've practiced long enough, I call it the pendulum. You'll see it swing for all these products, and is there enough data to say, yes, let's do it, and the initial studies look good, and then later bigger data says different, or then a problem occurs. So you'll see this swing back and forth here. I've seen it with vitamin A, vitamin D, vitamin E, and it goes on from there. All right. So summing up, conventional is scientifically based and I'll say relatively safe and effective. You all know that what we do is not terribly safe in all cases. Some people have unusual drug reactions. Sometimes surgeries don't go as expected. And then CAM itself, we already defined it here, but it just to understand it's continually changing. Things that might have been CAM in the past may one day become more conventional as we get more data. So CAM can be subdivided into different categories. We've got your natural products like herbs, vitamins, minerals, and probiotics. You've got mind and body practices, acupuncture, massage, meditation, and several others that you see. And I apologize if I'm going to be going fast on this. I have too many slides for this time frame, so and most of this is pretty self-explanatory, but there's energy medicine, that'd be your biofield therapies, therapeutic touch, light therapies. And then there are different practices based on history. So an example would be the Chinese medicine practices here. You've got homeopathy. That one I always think is interesting because it says like cures like. And the kind of example that's been used in the past is poison ivy, to treat poison ivy, which to you and me doesn't make sense. But when you think about our allergen extracts and immunotherapy, we're giving them, if they have pollen allergy, we're giving them injections of pollen. And then there's naturopathy. It uses natural remedies to help the body heal itself, and this embraces many different therapies, including the herbs, massage, etc. All right. Now, when we talk about complementary and alternative medicine, you got to remember what is looked into from an efficacy and safety perspective. And I'm going to go back and review a little regulation history here. So in the early 20th century, think about it, most meds were not created until the 40s, 50s, and onward here. We didn't have the internet. We didn't have big ways to share data here, things that occurred over the pond, over in the UK, etc. We're not easily getting into way here and vice versa. We did have the United States National Formulary, and the United States Pharmacopoeia is kind of a central clearinghouse, but there wasn't very much regulation behind it. And unfortunately, there were some harm was done with some of the medications out there, and I'm going to use thalidomide in the 1960s. Thalidomide was being marketed for insomnia, and off-use label was in pregnancy. It also worked for nausea. Unfortunately, over time, it was used with the pregnant women, and the children were found to have a birth defect called phocomelia, which is what you're seeing in this picture, and it's just foreshortened limbs there too. Because of the outrage on that, Congress created the Kefauver-Harris Drug Amendment. And what that did is told manufacturers, you've got to provide proof of the effectiveness and safety of their drugs before approval. So that's the whole FDA approval process. The required drug advertising had to disclose accurate information about side effects. You all see that on your commercials on TV or streaming these days. And they were to stop cheap generic drugs being marketed as expensive new drugs, like they were a breakthrough medication when they were a repeat of the old. So this was the initial way to provide a level of protection. And remember, this is for drugs. We're going to talk about some of the supplements that are under a different category in a little bit. All right, so that new act reassigned herbal medicines to the category of foods. This is where it deviated. It's not a drug. It doesn't fall under the same level of evidence for safety. 1994, Congress passed the Dietary Supplemental Health and Education Act, and this basically said that the supplements that are manufactured have to be proven to be safe, and that any representations or claims made about them are substantiated by adequate evidence, and that they're not false or misleading. Now, this is where you're going to see this little boxed warning on a lot of the supplements that people get. It says these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease, which would lead you to believe what's it for then. But nonetheless, they put these statements on there to try to avoid the, I'll say, misleading advertising. All right, 2007, the FDA came out with another good manufacturing practices for dietary supplements. And this is basically saying that they're properly labeled, free of adulterants. I'm going to give you multiple examples later. And that they're manufactured according to specified standards for personnel and equipment. And with that, in 2010, when the FDA looked at 626 products out there on the market, 71% of what they looked at resulted in citations for not following the practices, whether that was the manufacturing, the label versus the contamination. So that's a pretty high number. In summary, dietary supplements do not need approval from the FDA before they are marketed. So there's no proof of testing. There are no provisions in the law for the FDA to approve dietary supplements for safety or effectiveness before they reach the consumer, and that they fall under the umbrella of foods. All right, switch gears a little bit. Why do we care about CAM as a conventionalist? Well, this is the pie chart, and blue is the CAM, and orange is the conventional medicine. 10 to 30% of healthcare is delivered by conventional practitioners, us, but the majority is either by self or alternative providers. So it's a big chunk of the market. And now I'm going to go through a lot of showing how prevalent it is. This is adults using yoga, meditation, or chiropractor. And we're looking in 2012 is the blue, 2017 is the green. And you can see in all three areas, the percent increase using these practices has gone up. So just showing its continued growth. And then this is another one looking at adults in the 3 upper left, yoga, Tai Chi, and Qigong. And it's looking at the years 2002, 2007, and 2012. And at least for the yoga, you can see it's becoming more popular. This is also true in children. This is 4 to 17. We're looking at dark blue in the 2012, light blue is 2017. Yoga and meditation definitely went up in that time frame. Chiropractor stayed about the same. Here's just, and sorry, this is older data, but it's what I have available. It's looking at homeopathy providers and the numbers between 1990 and 1998, so dramatic growth. Here's herbalism in billions of dollars, and going from 2 up to 3.7 billion there in 3 years. So a lot of money being spent. Increase in the number of massage schools. Here's the U.S. Bureau of Labor Statistics. So the feds are getting in on this, and this is a massage therapist in 2016 to what they are predicting by 10 years in 2026. And it's just basically showing that the numbers are all going up. Same thing related to chiropractors. And then the shelf space on the drugstore is a good measure of how popular something is. It's also, for me, it's also how ineffective a given thing is. There's a reason there's a whole aisle of cold and cough medications. Because none of them are effective, so people just keep trying the next color or next brand. Okay. And then switching gears again, what medicines are they using here? This is a 2012 National Health Interview Survey, and the number one in their list was fish oil, followed by glucosamine or chondroitin, and then pre and probiotics here. As you go down here, this is basically your big box store flyer that I get in the mail every week and what they have on sale within that publication. These are just terribly common. And here's adults in the past 30 days, what percent used any of these products. And so here's fish oil, and if you run across the percent, 37% were using it in the last 30 days, glucosamine 19.9, etc. And then I found this online a while back. This is a picture of somebody's little storage area, and they will make your custom blended herbal formula. So if you have a passion for a specific product, they have the ability to potentially make it here. And it just goes down and tells you what type of extract, whether it's an oil, a honey, a tea, etc. here. I always love this part of alcohol extracts. It's $11 per ounce or $10 per ounce if you bring your own clean bottle. Always crack me up that you got a discount if you brought a clean bottle. Now, moving on, why do people use complementary and alternative medicine here? As always, it's going to be mixed across the board, but a good percentage thought it would be combined with conventional and that it would help. We gave an example of the fish oil and statins earlier. Thought it'd be interesting to try. I don't know why the curiosity would make you want to do that, but it does. Thought conventional medicine would not help. That's not uncommon that we find, doc, I've been using these inhalers for 10 years. They don't change anything. Then some of this is we are suggesting that it might be helpful. And so I think sometimes some of that's our personal belief and some of it's, I don't know what else I've got for you, which is sad. And then this is definitely a true thing. Conventional medicine's too expensive. If you look at the cost associated with what we do, it's pretty horrible. With that said, I will also tell you, if you go to your super vitamin stores, everything's $60 for a month's supply. And that certainly adds up through the year. Here's CAM used by adults in 2002, ever used in dark blue, light blue gray is in the past 12 months, and you can see the numbers are pretty high, so still very popular. Again, other things that CAM are used for, in this study, prayer was the number one reason that it was used, and then after that, it's kind of a mixed group of common therapies that were used. And then again, we're looking back at the various supplements in this report, percent being used. disease, the overlying theme of why most people are going in for the CAM is going to be pain-related issues, as you can see, back pain, neck pain, arthritis, etc. And then we'll throw in a little bit about, I'll say, mood disorders as a general thing, anxiety, depression. Looking at the money part of it here, in this survey, you're seeing in U.S. billions of dollars. This is in 2008, so you can imagine what 2002 to 2008, finalized in 2008. You can see that the majority of it's being spent on the red, which is the chiropractic care, which makes sense because you don't go to a chiropractor once. You go there for a long time to try to find resolution to your problem. Your massage therapy was next, and then by the time you get up to the yellow other CAM products, those are probably buying your over-the-counter supplements there. This is CAM visits and expenditure here. Again, you're going to see the more common one is going to be chiropractic care because it's human and overhead involvement and frequent visits. So going to be a big part of it. You're up top, your CAM, that's going to get your vitamins and all that. So you're not going to, your visits are just going to the store and buying the product on a monthly or whatever basis. And the reason for this chart, although the adults account for a big component of it, 94%, the children do have about a $2 billion cost that's being spent. So this is being used on all ages. All right, so why do people go to CAM? It gives the patient and family an active component in their health care. We all want to take some control of our life, and if you're not feeling like your inhaler is doing you well, and you read something about taking some vitamin D and atopic disorders, you might be motivated to say, let's reach out there and do that. It's an active component of your care. Number two, it's perceived to be risk-free or safe, natural and inexpensive. I would argue on a lot of those points here. I'd throw in foxglove here because, as you all know, that's where digoxin comes from, and I'm not so sure you would do well if you ate digoxin or foxglove. So there's many other plants out there that are harmful to humans and animals. A lot of people look at CAM as being preventive, and if I can prevent a problem down the road, that's where your mega vitamins, and I know of people who literally have the huge pill box loaded with endless supplements like that they take every day, that they're improving their immunity and getting rid of the toxins. And then number four, I puts provider and patient on kind of an equal hierarchy. Instead of always having the doc telling you what's going on, why wouldn't you want to also have a little bit of say? And of course that runs into some difficulty with our Google searches and all that, but it's for us to be aware of what people why they may want something and how we can appropriately help them with that. It's attractive because traditional medicine provides little cure. I've never cured asthma in my life. I've helped manage it in many different ways, but I can't cure it, unfortunately. CAM is available without a prescription. Trying to get into a doc these days, waiting 4 to 6 months to see a new specialist is not appropriate, but it's what it is. And, hey, I read about the vitamin D again. I can go down to the store and spend $60 and I'm done. And then there's also a wealth of information online. I didn't say that was necessarily correct or scientifically proven, but you can certainly find a lot. And I would be remiss if I didn't talk about the placebo effect, because people are going to tell you what they found effective along the way. The word placebo is Latin for I will please. Who wouldn't want to do that for your patients? Even in Cochrane reviews, they show discrepancies between the objective and subjective findings in placebo use. However, placebo does have an effect. It's small, but it's significant to the patient at times. Here's a little placebo effects study. It's pretty small. 39 patients with chronic asthma. There are 4 different treatment arms of it here. One was albuterol inhaler. That's the active one. Placebo inhaler, which is placebo 1. Sham acupuncture, placebo 2. And then no intervention was the 4th group. And they found out that all patients received each of the 3 interventions plus the no intervention session in random order through 7 days apart. Patterns repeated 2 more times for a total of 12 visits by each patient. And what they found is that each visit, lung function tests were, I'm jumping ahead, sorry. At each visit, lung function tests were administered and patients' self-reported symptom ratings were recorded here. Here's what they found, sorry. Albuterol did increase lung function. That is no surprise to us. We see that every day when we do our reversibility. Placebo and the no treatment did not change the lung function. Again, not a big surprise there. However, the patient self-reports on their symptoms showed significant and approximately equal improvement with albuterol, the placebo inhaler, and the sham acupuncture. So that's the placebo effect there. When we do CAM, you have to ask, why is there a lack of studies? How come people aren't out there trying to prove it? Well, here's why. It's costly to provide large, well-designed studies. The cost in 2003, a long time ago, phase 1, all the way to market, about 90 months of time, so many years, and about $802 million to do that. If you're selling a super vitamin that you can make money on now without $802 million spent on a phase 1 to market study, that's what you're going to do. Even our federal government's not going to be too interested in spending that type of money. More recent data, 2021, gives you the range of 161 million all the way up to $4.5 billion as our technology gets greater and greater. And we're all seeing that with biologics. You know, the cost to get that stuff to market's a lot. Eventually, that'll all come down, well absorbed, because the technology new becomes old, but they'll be newer later. So it's difficult to fund this stuff privately. And it's difficult to blind studies with some of the CAM. You know, so think about yoga. How do you do that? I'm not even sure what sham acupuncture is here. I'm sure you could do it in the wrong place or not the right depth or something like that. But and then the other part is we don't always know the mechanisms for any of these therapies, and so it's hard to know what interaction we're getting and where and why. And then the outcomes may be heavily affected by the patient perspective. So what to do, because you are going to see patients, doc, I don't want medicines, I just want something that'll fix the situation. There's got to be something I can do or buy over the counter. You want to listen to your patient, be non-judgmental, keep updated on the latest information. Don't push it all away, because some of the things that we used to think no or yes now, do discuss concerns for efficacy and safety, and then make sure you can provide them with good resources. And I found that one's a real helpful one, because 1, it shows that I care, 2, it shows that I'm looking at some data, and 3, it gives them data to help make a judgment in the future. And the National Center for Complementary and Integrative Health, it's part of the NIH. It was renamed. It used to be NCCAM and renamed in 2014. And what this subgroup of NIH does is tries to go through scientific investigation, looking at the usefulness and safety of complementary and alternative medicine interventions and their roles in improving healthcare. And unfortunately, in a big country as we're in, the budgeting for this 2019 was 146 million. That's not a lot of money, unfortunately. So it's, you know, they can't go and look at every other product that hits the market, but they're out there and they're doing a job of surveillance at least. So and I'm going to give you a bunch of resources here. I'm going to try to open the hyperlink. You have to tell me if it works or not. It usually does not when I'm in the share mode, so I did do a copy of it here. But the NCCIH website, and it's listed there. You can go in, you can look up a particular area of interest. I got echinacea in your lower left here, and you can link to that page and go through and find out what's the background of echinacea, what do we know about it, what don't we know, what hasn't been helpful in there. I listed some common ones like allergic rhinitis and butterbur on that. I'm going to see if I can open the hyperlink, and if it doesn't, at least you got the picture in the lower left. Take a look at that. Okay. Are you able to see the NIH screen that I just popped up?
Yeah, I can see it.
Oh, okay, fantastic. First time it's worked in years. So this is just on echinacea. If I go back to health information, you can go in. No, I don't want to sign up. And you can choose whatever you want. So let's go look at, let's see if we can find one on vitamins and minerals. Click on that, and it runs through the various information that we have on that too. And then if I go back a little bit, let's look at St. John's wort and Deperna. Let's see if we can find seasonal allergies. So you can go in here, you can pull things up real quick, get a little bit of background information, And you can certainly share that with your patient too. Okay, so that's one resource. Now I'm going to try to get back to where I need to be and hopefully not lose everybody. There we go. Okay, all right. So I should be back to my slide set. Hopefully you're seeing that. So one resource. Next resource, they do make an app for this. I have it on, I have a little medicine folder, and that's where I put all things like this. This is when you're in the room and somebody comes up and says, hey, you know, I'm wondering about ginkgo biloba and its effect, blah, blah, blah. And you can on the spot pull that up. And it's a neat thing. The patient can download it from their app store. So that's a good resource on the spot for you. I do recommend downloading that one. And then there's clinicaltrials.gov, and this is a registry database for publicly and privately supported studies in there. And I think I'm going to be able to show you. Okay, here's some common things like vitamin D to prevent colds and asthma flares, magnesium and asthma. Remember, we use mag sulfate when somebody's in the hospital with horrible asthma. And this is at clinicaltrials.gov. And again, you can go in and look up a given topic. I've got several of these up here. Asthma and acupuncture as an example. Here's the link to it. I'm not going to slow us down by going to look at that link today, but this is an example, and this is like vitamin A and D intake in pregnancy and asthma development. So that's on asthma in children, and there's lots of good topics related to all that stuff there. And then next I've got Medline Plus, another link here. You go in and you choose your alphabet or list of herbal and supplements here, go down, click on it, and then you'll get a good amount of information related to it. And then another source, and this is where some of this talk came from, is up to date. They have these 4 different sections. I didn't check this year for any newer ones, but they have one on CAM therapies for allergic rhinitis and conjunctivitis. They have a discussion on Chinese herbal medicine for allergic disorders. They have it in peds, and then they talk about supplements. So that's another good resource. At the very end of this talk, I'll give you a little algorithm chart that they use to help decide if information is good or not. Now I get into the buyer beware, and my disclosure on this too. My goal is not to get people to stay away, but to recognize that all CAM, just because it's being sold over the counter, does not mean it's safe, and there are potential problems for this. So I'm going to give you some of those examples. Remember that a dietary supplement is essentially a food, and here's some kind of definitions, more of it. It's not regulated as a drug. It may be described as natural. That doesn't mean safe or effective. You got to worry about lead, arsenic, other contaminations. And then there will be frequent warnings on dietary supplements. I assume this is a way to try to avoid the liability issue. Consult your healthcare provider before starting a supplement. And then they pick out kind of the higher risk groups, like pregnant or nursing or giving it to a child. Some of the other ones we'll talk about geriatric patients too. So this is a product that in 2010 got recalled by the FDA. It was being labeled as a supplement for healthy lung, respiratory system, and kidney yang. Somebody write to me about what kidney yang is. I didn't look that up. And they announced that that there was a presence of lead in this product. So here you spent your $70 to improve your, we'll say, respiratory system, and you ended up getting lead that was 10,000 times higher than the allowable by FDA. Now, it's scary to think that we're allowed to have lead in our food, but it is a background noise, and that they define what the acceptable levels are. And this was 10,000 times higher. This was a product that I do recall when this was going down. Is tryptophan, which is used for insomnia. And in 1989, it's out in the Southwest, there were several individuals that were presented with intense myalgias, and in their blood workup, they had a peripheral blood eosinophilia. They found out that the tryptophan was contaminated with this EBT, which led to those symptoms. When the product was removed from the market, all the other issues went away. And then here's another product called Kella. It's part of the carrot family, and it's thought to be helpful for respiratory support. It does contain furanochromone, which for those of us who are familiar with the cromolyn drugs, we use that from anywhere from our nasal allergies to our GI issues. And then there have been inhaled versions for asthma. For anybody new to our business, they're not the most common ones used anymore, but there's still some out there. What I think is interesting on the labeling on this product, it says periodically monitor liver function tests. Well, you and I can't easily go get those tests done. So that's not extremely helpful. And what person's going to remember to go back and read that again? They'd go, oh, I better go check with my doc. Recommend that the patient pursue a physician-supervised cardiac workup if Kella is being taken as a heart pain medication, angina. And then it also gives a warning that it may have hypotensive effects. So if you're on antihypertensives, it may not be great for you too. So, even though the drug may have a history of potential help, this monitoring would be hard for most people to follow. Do you remember that there's lack of control of the quality and the efficacy of these supplements? They're different plant species, plant parts. Is it the root, the stem, the leaf, the seed that you're getting? How is it harvested and storage, processing, accuracy of labeling, standardization? We have that same thing with our weight per volume and our allergen extracts, purity and efficacy. So those are all things that vary, and that's why you can't compare apples to the oranges with these products in one company to the next, because you don't know what you're getting. You do need to be worried about drug-herb interactions, and the one that got the biggest attention up front was St. John's wort, which was being used for depression. It's a cytochrome P450 metabolizer, and it interacts with cyclosporin, oral contraceptives, etc. And then ginkgo biloba has an anti-platelet, anti-thrombotic effect too, so you got to be worried about things like that. The FDA does have what's called FDA MedWatch, and you can sign up for it. You can even get messages sent to your email about recalls along the way. Here's the link for that. I brought an example down in May of 2022, and this is public information, so I've got names on here. Walmart did a voluntary recall of all lots of this King Joint supplement, and the reason people probably liked it is it had like clofenac in it, which you all know is Voltaren, is a brand name here. So yes, it probably did help with your joints because you were taking an anti-inflammatory. You can go find safety reports via this portal right here. Just sign them, create your own account. And then what you will get is messages like this. FDA advises patients not to use herbal doctor remedies, medicine, and it gives you the description on why. And another issue about safety in herbs here, and I'll just throw out some examples of nettle and hypoglycemia, ginseng and hyperglycemia. I'm hypertensive with love for licorice, and it can be associated with hypertension. Gave that up. Here's something on Up to Date. They've given a list of all these medicines that can cause hypertension. Again, licorice is down there. Okay. So I'm going to go more specific to the world of allergy and immunology. Want to do a fair and balanced report here. I do have some positive studies. Most will be on the unknown or negative side. There's more data that's always going to be coming in, so staying up on it is important. Online is probably the best way you're going to get your information. And remember, it's just commonly used in atopic disorders, 42%. Here's a study looking at allergic rhinitis in traditional Chinese medication. 8 herbs, they found no significant differences in symptom scores or rescue medication use. So not a win then. Another one, Up to Date, looked at 12 randomized, systematic review, 12 randomized controlled studies. The studies vary quite a bit, which is a weakness in the overall study. The meta-analysis showed that traditional Chinese medicine significantly improved quality of life compared to placebo, but it didn't change the symptom scores, itchy nose, sneezing, or total nasal symptoms. There's allergic rhinitis acupuncture. Some benefit on perennial, not on seasonal, not found to be cost effective. In days where you can get cetirizine at 3 cents a tablet and a nasal steroid spray for $5 for a month's supply, you can see where going in for acupuncture frequently would not be cost effective. Here's butterbur, and this is kind of interesting. Butterbur contains pethicins, if I'm saying that right, which may alter the leukotriene pathway. So in 3 of 6 double-blind randomized controlled studies found that butterbur was more favorable to cetirizine and fexofenadine. So boy, that sounds very promising. However, it contains pyrrolizidine, which may be hepatotoxic, mutagenic, and carcinogenic. So not a win situation. Here's allergic rhinitis and capsaicin, derived from red peppers, and it's thought to desensitize nerve fibers and reduce nasal hyperresponsiveness. And actually, it was found to be helpful in reducing nasal symptom scores. So here's a thought. Back to the licorice. It's a plant. It was used for ulcers, bronchitis, and more. Part of the pea family. So if you got a pea allergy, you have a potential for licorice allergy. It may cause hypertension, as I alluded to earlier. It may potentiate effects of steroids. And when it came down to bronchitis, the NIH said no, not helpful. Here's asthma, allergic rhinitis, and lactobacillus. And when it comes down to allergic rhinitis, it was grade C, as well as for asthma. That's kind of in the neutral to not helpful zone of the grade system. Here's asthma and acupuncture. Many uncontrolled studies showed benefit. This is a meta-analysis, 11 randomized placebo-controlled trials. Acupuncture was not associated with significant clinical improvements. There were small studies and limited information. That's on up to date. And here's asthma in chiropractic in 80 children. They either got active manipulation versus placebo, standard asthma care. No significant differences in morning peak flows, symptoms, use of beta agonist, quality of life, spirometry, or airway responsiveness. Here's asthma and massage therapy. In short, wasn't helping much in the 9 to 14-year-olds with improvement in overall spirometry. It did decrease their anxiety and attitude towards asthma. And if you can't breathe, having something that may relax you might be very helpful. And in the 4 to 8 years, it did decrease anxiety, but it did show some improvement in PFT. Relatively small study, though. Asthma and other kind of controlled breathing exercises, essentially no significant change in FEV1, hyperresponsiveness, and the methylcholine challenge. Some people did say they had fewer symptoms, and that is certainly a reasonable thought. Asthma and biofeedback here. Let's see, most systematic reviews didn't detect any effect. There was a more recent one with 94 asthmatics trained in heart rate variability and biofeedback, decreased meds, fewer symptoms, and improved PFT. There's a little positivity there. Here's echinacea, 9 species. The species varied per study, mixed results on prevention and treatment of URIs. Eczema and probiotics here. Probiotic may prevent eczema development. I'm going to say that lightly. It's complicated by strain, dose, timing, and duration. And then the efficacy of oral live probiotics versus placebo in children. We looked at a large group here. No significant difference in the SCORAD or quality of life. I'll reflect back to one of our talks just recently by Dr. Chacho and some of her work related to fatty acids and some of the kind of probiotics in that process. And some promising studies. Eczema in primrose oil, no difference. Eczema and zinc. As you know, zinc's a big cofactor in a lot of enzymatic processes here. It does relate to CD4 and natural killer cells and IL-2. Here's the different grading for everything. A little bit of help with scalp, fungal infections, and immune function. Common cold, grade C. Eczema and psoriasis, grade C. All right, and I'd be remiss without talking about cannabis because that's everywhere these days. Here, the states legalize this. You'll find things like this on the website. This is Medical Jane, as you can see in the picture. It's CBD versus asthma. So let's talk about cannabis a little bit. Growing interest in that here, marketed for endless disorders here. Legality in question, although that's definitely changing state by state, in the labeling and marketing here. Cannabis comes in, we'll say at least 2 strains. One could argue 3 strains. There's sativa, which is the stimulating strain, indica, which is the sedating, and then there's ruderalis, which may be a subcategory of sativa. It just depends who you talk to. THC is the active ingredient or the psychoactive component. CBD is the cannabidiol, is what's being touted for a lot of healing properties, anti-inflammatory. Hemp is basically a version of cannabis that has low THC naturally, and it's grown for industrial and consumable use. So you'll hear like a hemp clothing and rope. Understand too that cannabis has over 400 plus compounds, and I think 485 was the most recent I saw. We do know cannabis with THC is approved through the FDA. Here I've got a couple of the products listed. The first Epidiolex is the CBD component here. But it is for treatment of seizures, whereas the lower ones, the THC, are used for pain and hunger stimulation or appetite stimulation. And then a little science on the cannabis here is that we do know that it does affect cytokines. We got IL-4, 5, 10, and 13 being looked at. These are mouse models here. And what you've got is, in the yellow, I highlighted the different cytokines. The first bar is the control, so your baseline IL-4 concentration. The next middle one is in an asthmatic, he's the control group there. And you can see they've got a high IL-4 concentration in asthma. You put them on the CBD and their numbers come back down to near baseline without asthma. And this plays out with all 4 of the cytokines. So I think that's of interest. Okay. And we're getting close to this. I appreciate your patience on all this. Special populations always need to think about the CAM and instructing patients. Pregnancy and nursing, there's positive information, and then there's certainly fetal risk during pregnancy, infant risk in nursing here. In infants, we have also lack of information. Nobody's going to run out and push the products for the younger age group to be researched. Not enough numbers and too costly. Potential greater risk in a smaller package with a high concentration of medicine and doses unknown, and risk with contamination and infant growth. Geriatrics, a lot of geriatric patients will have decreased liver and renal function here, become less stable on our feet. Our orthostatics are a mess. So our ability to respond to something that maybe, partial sedating or impairing may be less than perfect. And then in the surgery population, I do know, I've seen this with personal stories of going in for surgery. Are you taking any of these supplements here? And these 3 were altered mainly for the antiplatelet effect. It's probably good not to bleed if you're going to be cut open. Here's a list of the where to find the information here. These are all ones for the most part that we talked about today with your patients, how to help them navigate this. Internet accessibility and information in your office on your phone. Review the date of information. I've had 2 parents come in, not in the same household, kind of a hostile situation. Dad was convinced why we were supposed to do one thing. I looked at the article he submitted to me, and it was from like 1953. So, make sure what information you have is timely and where it comes from. The source of the information, universities, academic center, and government sites are less likely to provide biased information here. They're not selling you a product. Check the references, and does it apply to your group of people too? Review our qualifications, and certainly visit several sites. And be wary of any product that says satisfaction guaranteed, cure-all, miracle cure. The pseudo jargon used, purify, detoxify, and energize. When everybody tells me they're trying to get rid of toxins, I go, what toxins? Because I don't know what they're talking about. Careful of these products that are all anecdotal evidence here. They're testimonials of, I took this and this made me the greatest whatever. And then you will find on some websites the accusations towards the medical community and or government. And there's several groups out there that I've personally gone to the websites and read what they say, and it's pretty horrific. Remember, natural doesn't always mean safe. Tobacco is natural. And then the drug interactions that we talked about. This is from Up to Date, and another way to kind of think about how to approach this with your patients here. And this is a schema for advising patients on herbal products here. And the first column is quality, second efficacy, and the third is safety. And it comes down and says, is there quality? Is it present? Is it uncertain or absent? And then you combine that with the next efficacy in the same three parameters. And then you combine that with safety. And if you've got good quality, efficacy, and safety, probably should recommend that. And then when you get down to the uncertain and absent, it's, counsel and caution and discourage if everything's, if there's no data. So it's not a reasonable schema to follow. And with that, that's the end